Hello, everybody. Welcome to another episode of Prescribing Lifestyle Podcast. Today, I have another special guest. He is Dr. Barton Jennings. He is a respiratory physician or a lung and sleep specialist. In fact, he's a local respiratory physician. His business is lung and sleep, and I've connected with him for quite a few years through the low carb community. He is low carb friendly, which is quite special to our low carb community. Thank you for coming on, Barton.
Thanks very much for having me, Avi. It's nice to talk.
Yeah. Thank you for your time. I'll get you to just briefly tell us about your low carb journey. How did you get into this journey?
It was actually 2018, and we were going to a local gym, and that was run by a low carb dietitian and a chiropractor. And we loved going to this gym, and the low carb um, dietitian, Vicky Curiel, had this 6 week low carb challenge. And
Mm.
so it was actually my wife's idea. She thought it'd be a great idea for us to do this challenge. And initially, I basically said no because it went completely against everything that I'd learned at uni. Having said
Yeah.
that, I had tried to lose weight for the preceding 5 or 10 years by exercising every day or very frequently. But then I would like exercise for an hour and I'd get a banana and an up and go on the way to work, thinking that I was doing the right thing. Anyway, so kicking and screaming, I was dragged along to the low carb challenge. And
Mm.
4 weeks in, I'd lost 4 kilos and I was starting to feel really good. And I was thinking, this is so strange because it just seems like it shouldn't be healthy. Because as I said, it goes against what we were taught.
Yeah.
And so that's what made me think there has to be something to this. And so from then, I've just researched it and read into it. And the more I read, the more interest I got. And so after initially saying I'll do for 6 weeks and then that's it, I'm going straight back. I've never turned back. And
Wow.
so
So it's
it's been
about
awesome
six
for
years
me.
now?
And yeah, yep. And
Wow.
so after it works so well for me, now I recommend it to patients and it's changed all, my work. So
Mm.
it's been really nice to be able to educate people through my practice in to be able to get the same sort of success as I know that you enjoy through your practice too.
Yeah, amazing. In what instances would you recommend the low carb lifestyle to your patients?
Well, in any instance, so
Mm-hmm.
any opportunity I get to talk to people about it, I talk about it because I think it's so useful just to get the message out there. And the more we can get the message out there, the more people take up that sort of challenge or make that change to their own lifestyle, and then they start telling others. From a medical point of view, my specialties, as you said, are respiratory and sleep. So
Yes.
it's quite common that we're faced with a situation in respiratory where someone is short of breath, but they may
Mm,
not have lung or heart disease.
mm,
Often it's their weight that's contributing to it.
mm,
Or it may be that they do have lung or heart disease, but that's optimally managed, but they're still short of breath.
mm,
And so weight loss can be helpful. And and then there's also situations where, just improving their overall health. From a sleep point of view, a lot of sleep problems are related to snoring and sleep apnea, which isn't solely due to being overweight, but is frequently contributed to
mm.
by weight. And so weight loss will often help these people and sometimes avoid other interventions such as CPAP or dental splints to treat their snoring and sleep apnea. So I find it comes into my clinical practice just almost every patient.
Wow. Do you find that they come in for a bit of snoring or sleep apnea and you give them some low carb advice and do they come back feeling much better?
Hmm.
Well, yeah.
Quite frequently. Yeah, quite frequently. Yep. And it's so satisfying, when they do come back and they say that they've made changes to their lifestyle and to their nutrition and started to feel better. And sometimes depending on the situation, we may repeat a sleep study, or it may be that their snoring has gone away and that might not be necessary. But quite frequently, yeah, weight loss can significantly improve sleep.
Wow. And they've escaped the CPAP machine. They don't need it
Yeah.
now. Save some money.
Exactly. Exactly. And hassle.
Yeah, yeah, and discomfort, and it's not comfortable sleeping with the CPAP machine.
And there's so many other benefits from, improving overall health. And so CPAP is very effective for sleep apnea. And, frequently I'll recommend that people, do treat their sleep apnea with CPAP, but in conjunction with improving overall health, because that has,
Mm,
so much far further reaching benefit to their health and how they feel.
amazing. So I want to ask you about snoring. So let's say they're just snoring, but not quite sleep apnea, and you did a sleep study and not quite needing a CPAP machine, and you've given them low carb advice. What else would you suggest for snoring that you can suggest?
Um, so I guess firstly, the situation is slightly different in adults and children. I don't do pediatrics, so I don't
Mm,
specialize in children and don't look after children. But what I do know is that if children snore, then it's a problem because kids who snore don't concentrate as well. They don't do as well at school.
mm, yeah.
And so that needs to be investigated, not by me, but by the GP and
Mm,
possibly pediatric sleep if necessary. So and sometimes that it requires surgery. So upper airway surgery, tonsils and things like that can be very effective.
mm,
Um, in adults, snoring is more so about the sound of snoring. And I always, say to people, snoring is in the ear of the beholder. And so
mhm,
sometimes when snoring is an issue, it's hard to actually measure how bad snoring is because it's really all reported to you by the person who's hearing it. And so
yeah.
quite frequently that person may be a light sleeper. So it may be that actually that someone being a light sleeper may report snoring much more than somebody who's a deep sleeper. So someone may snore worse, but their partner is a deep sleeper, never complains about it.
Yeah.
Where
Okay.
sometimes
Yeah.
just a bit of heavy breathing can be reported.
Oh,
So that's the
okay.
first
Yeah.
thing. So it all depends upon who's listening to the
Yeah.
snoring.
Mm,
But if there is snoring without sleep apnea, then those people tend, not to like CPAP. So I don't think the CPAP's a good idea because they don't feel any better.
mhm,
So they're much better off with other treatments. And so I usually like to start with simple things and then progressively go to more complicated and more expensive. And
mhm,
so weight loss, is the best
mhm,
because if weight loss results in reduction in snoring, then as I say, you get all the extra benefits
mm,
from that reduction in weight and the improvement in your nutrition. Sometimes avoidance of sleeping on your back can be
mm,
very helpful. And so when you sleep on your back, your jaw and your tongue fall backwards and crowd the airway more easily. So sometimes people snore on their back, but not on their side. Often they know about that because they get the elbow from across the
mhm.
bed or to,
Yeah.
to roll over. Some people are able to avoid sleeping on their back. Sometimes they're not. And people often hear about like the tennis ball technique where you can sew a patch on the back of a t-shirt and put a tennis ball in so that if you roll onto your
Yeah.
back, it encourages you not to. Variable success.
I
There are
have
there
heard
are
of
some
that. Yeah.
devices
Yeah.
that that help doing that. So there are two devices. One's called BuzzPod and one's
Oh,
called Night Shift. So
okay.
is a band that goes around the chest, and Night Shift is a thing that's like a necklace that sits around the neck. They
Oh,
work in a
okay.
similar fashion. They monitor the position that you're in, and if you do roll onto your back, they gently vibrate to encourage you not to roll, not to sleep on your back, but to actually move off your back.
Wow. Okay. I learned something. I have no idea about those.
Yeah, so they can be quite effective sometimes if people want to avoid sleeping on their back.
Hmm.
The other thing that's really important from a sleep and snoring point of view is nasal breathing.
Mm,
And breathing through the nose is really important, for health. And I think it's
mm,
something that's actually under recognized in its importance and hasn't really been spoken much about for
mm,
a long time. But
mm,
probably recently, I think, has the importance has started to become recognized. But it's really important for sleep because say if you sleep for 8 hours and if you're breathing through your mouth for that time, it's a lot of time that you're spending breathing through your mouth and not through your nose.
mm,
And so breathing through your nose is very helpful. Firstly, it humidifies the air and it
mm.
filters the air,
Yeah.
and that can affect the upper airway. And that can often contribute to cough. So often people with chronic cough, it can be
Mm,
because they're breathing through their nose.
mm,
The other thing that breathing through your nose does, especially, and by closing the mouth during sleep, is that it brings your bottom jaw and your tongue slightly forwards.
mhm,
But actually protects the upper airway from that collapse, which is what's causing the vibration and causing the snoring.
mm,
So just through closing the mouth is effective for reducing snoring.
mm,
And breathing through the nose also airflow is laminar instead of turbulent,
mhm,
and that reduces upper airway irritation and also reduces snoring.
mhm.
And the more you breathe through your nose, the more nitric oxide that is released, and
Yeah,
nitric oxide helps clear the nose. So the more you breathe through your nose, the clearer your nose becomes.
yeah.
So I love to tell people that they should tape their mouth shut,
Mm-hmm.
and I tell them that that's what I do because I tend to breathe through my mouth when I sleep, and I tend to get a dry mouth in the morning, and so I tape my own mouth shut. And sometimes, in conjunction with that, if people have difficulty breathing through their nose, I think they get benefit often from just some nasal spray, just Fess, saline
Yeah.
nasal spray, just to clear the nose before sleeping with their mouth closed.
Great, amazing. Do you find people are receptive listening to your advice on taping their mouth?
And I reckon that there are two camps of people. Some people are
Mhm.
like, "Oh yeah, I've heard about that," and some
Yeah,
people just look at me like I'm like I'm absolutely crazy. Um, but then I show them on my computer, like I did a video of myself taping my mouth, and because I recommend it to patients so often, I give them that link to my video,
yeah,
and then in that video, I just show them how I do it.
yeah. I have
And
actually seen your video and I've shared your video on my social media, and I almost always tell my patients to breathe through the nose day and night and even when
yep,
exercise, and
yep,
also suggest them to try taping. And I say give yourself a week, and you can, first night you might last 2 hours, second night you might last 4 hours, and then maybe you get used to it after a week.
yep. Yeah, and that was certainly my experience, and I think that that's similar to the experience that I hear that people have. Mm.
Yeah, great. Um, my very dear girlfriend know that I advocate mouth taping, and then she sent me this study saying that um, there are people that can suffocate, and there's not enough studies that showing the benefits of mouth taping. What do you think about that article? I actually sent you that
Mhm.
article, and they were concerned that people can suffocate, and there are not enough benefits on mouth taping.
Mm. I saw that, and I think firstly, my feeling is sometimes when these things
Hmm.
um, come to light, and especially if they're promoted through social media, there's always people that want to prove it wrong and say, "Oh no, this doesn't work."
Yeah.
When I had a look at that article and I had a look at the studies that it referred to in their systematic analysis, a systematic review, two of the studies actually did show benefit,
Okay.
and they were probably two of the better quality studies that were reviewed. Some of the other studies showed no difference. I couldn't see any evidence to show that anybody had suffocated or had any significant adverse outcomes. So I'm not really sure that that's true. And and when I recommend that people tape their mouth, my recommendation is one single strip of tape straight down the middle, so there are gaps at the side.
Yep.
And so people can still breathe through their mouth. So I don't think there are any safety issues. And I've certainly
Yeah.
never had a patient had an adverse effect, and hopefully you haven't either.
No,
So I
I
don't
haven't.
think, in terms of all of the things that we do in life, I think that putting a bit of sticky tape across your mouth to
Mhm.
sleep is not a risky behavior and not something that has adverse outcomes. But heaps of people respond with a reduction in their snoring and report improvement in quality of sleep.
That's great to hear you had good experience from it as well. I want to change topic to talk about how to optimize sleep, because we know that sleep is so important.
Mm,
What are your top tips on how to get a good night's sleep? Because there's so many people suffering from insomnia, or they get to
mm.
sleep and then they wake up in the middle of the night, or some people have lots of worries, or they wake up too early. What, how do you approach insomnia?
So I think Sort of my approach to any sleep issue is firstly to think about the quality of sleep. And so, irrespective of what the problem is, the first consideration is this person getting good quality sleep when they are asleep? And the most common thing that affects quality of sleep is sleep apnea. And so it's important to do a sleep study to see is there sleep apnea or is there periodic limb movements of sleep causing sleep fragmentation and or is there something that's affecting quality of sleep? Because if there's something affecting the quality of the sleep, it doesn't really matter what you do,
Mm,
you're not going to optimize that person's sleep.
mm,
If you do a sleep study and the sleep quality is fine and sleep apnea and other things have been excluded, the next thing I think about is circadian rhythm.
mm,
And I think circadian rhythm or body clock is an under-recognized problem with sleep. And
mm,
so somebody may present with insomnia that they can't get to sleep. And the typical situation is, say, your 21-year-old who can't get to sleep and then can't get up in the morning to get to work. And they get
mm,
sleepy during the day.
mhm,
But they complain about not being able to get to sleep. And so the common response to that, especially from parents, is, well, if you can't get up in the morning, you've got to get up earlier. You've got to go to bed earlier.
mm,
But it's actually not the right thing to do. Going to bed early doesn't work because what's happened to these people is that their circadian rhythm has shifted forwards.
mm,
So their body naturally wants to fall asleep later and get up
mm,
later.
mhm.
So if they go to bed earlier, then they just lie there awake and then
Yeah,
they get frustrated and it
yeah,
doesn't actually resolve the issue.
mhm,
And so what they need to do is actually adjust their body clock. And
mm,
the way they should do that is actually by adjusting the time that they wake up
mhm,
and gradually bring their wake time earlier by half an hour every couple of days.
mm,
And then after waking up, they need to expose their eyes to bright light
yeah,
because that turns off the melatonin and tells
mm,
brain that this is now wake up time. And so as they wake up half an hour earlier every couple of days, they get that exposure to light half an hour earlier
mhm,
every couple of days. And so brain is basically being told that wake time is gradually getting earlier.
mm,
And it's important to do it early because if, say, the natural wake up time is midday and they suddenly wake themselves up at 8 o'clock, then that means that they're waking up prior to the nadir of their body temperature. And so, what happens about 2 hours before our natural wake up time is that our body hits its lowest temperature. And for the next 2 hours, a whole lot of physiological changes occur to prepare that person for waking. If you wake up during those 2 hours, it's okay. If you wake up at your natural wake up time, it's best. If you wake up more than 2 hours before your natural wake time, it causes mass confusion to the
mm.
brain. And it
Okay,
actually causes the body clock to go later. So it actually makes the
okay,
problem worse.
wow, okay.
And so that's why they need to gradually shift their body clock.
So let's say they're waking up at midday, then I should tell them to wake up at 11:30
Yeah,
for a
11:30
week or
for
so.
just for a couple of days, 11:30 for a
Okay.
couple of days, 11 o'clock for a couple of days,
Mm,
10:30 for a couple of days, 10 o'clock. And gradually you push it back
mm,
earlier
yep,
until you get to the point where they're happy to wake up and then you have to maintain it,
yep,
which means no sleep-ins on weekends
yep,
because then it just undoes all the hard work because the body clock is naturally going to want to get later.
yes,
This is your typical night person.
yes.
So when allowed to stay up late and sleep in, the body clock will shift forwards because that's what it wants to do. So
Mm,
when you push it earlier, you've got to push it back gradually with light
mhm.
and then hold it there.
And then they
And
go to bed
then,
earlier and earlier.
yeah, then gradually go to bed a bit earlier.
Yeah, awesome. What about those people who wake up in the middle of the night and they can't get back to sleep?
Um, so then, so the next step after circadian rhythm is all about sleeping habits
Mm,
and uh, trying to improve sleeping habits. And the most important thing from a sleep habit point of view, I think, is a regular time to bed and a regular time to wake up. And if anyone's ever taken their baby to sleep school,
mm. Yep,
that's
I
essentially
have.
what they do.
Yes, I
They
have
get that
actually.
routine, 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 routine.
Mm,
Uh, but it's the same as adults. We are best when we're in strict routine. And so if we have a regular time to bed and a regular time to wake up, that's most important.
Mhm.
Now, what happens in between those two times is a bit out of our control. It's not possible to control whether you will wake up throughout the night or not, but you can control the time you go to bed and the time that you get up, and you can keep that constant. So waking up at night time, it may be there may be an underlying cause for that. So the common thing is, a lot on the mind,
Mm.
waking up, then suddenly the mind starts racing, and often depression and anxiety manifest as waking up at night and then often not being able to get back to sleep.
Yeah.
And it can also become a bit habit forming. So that wake up and get disappointed that I've woken up again and can sort of contribute to it. And it becomes a bit of a vicious cycle.
Mm.
And so I think to try and improve that, firstly, we need to make sure that there isn't a mental health issue. So depression and anxiety need to be managed on their merits. And then what we need to do is to employ all of the good sleeping habits. So avoidance of bright lights and phones in the evening, avoidance of work in the lead up to sleep, trying to have a period of winding down and relaxing to prepare the body as best as possible
Yeah.
for sleep. If people do wake up at night time, I think that the best thing to do is to lie there and rest.
Mhm.
There are sort of two schools of thought. Some people say, well, bed is only for sleep. If you're not asleep, then you should get up and do something else. And so you could
Mm.
get up, do something else, and then reset and go back to bed and go back to sleep. That works for some people. And if that works, that's fine. That's a well-known technique. My feeling is, and maybe especially for me, the best thing to do is to lie there and rest.
Mhm.
And there's something that happens that's really interesting and it's really common. It happens to everybody, but it happens more frequently in people who wake at nighttime or report poor sleep. And it's called sleep state misperception,
Mm.
which essentially means that you can perceive yourself to be awake, but you're really asleep. And a part of it is due to the fact that time asleep goes fast and
Yeah.
time awake goes slow.
Yeah.
So if you lie there and you might look at the clock and 3 or 4 hours may pass, you may spend 20 minutes of that awake and 2.5 hours asleep, but you may actually perceive that you've been awake the whole time. And a clue to it happening is often people have experienced the situation where they feel like they haven't slept for hours, but time seems to have gone quicker than what it would have gone, say, if they were on a long bus trip or if they
Mm.
were on a plane trip, with someone kicking their seat or someone screaming next to them, where time would go really slow.
Mm.
But lying there at night time, sometimes time goes quick. And the other clue is that sometimes people report not sleeping throughout the night, sometimes not sleeping at all,
Mm.
but then they're not sleepy the next day.
Mm. Yes.
And so it's not biologically possible to be awake the whole night and not to be sleepy at all the next day. Because if you think about times in your life where you may have not slept at all, and maybe that's on a long flight or an overnight trip or a night shift or the other situations that might result in not sleeping, and you feel ghastly the next day.
Mm.
You can't stay awake. And so I think it's useful for people to recognize that that happens. Because if you recognize that it happens, then it takes away a bit of the anxiety about not sleeping. And the idea of just lying there and resting, you probably are getting better, some sleep, more sleep than you think.
Yeah.
The other thing I think is helpful is if you wake up, then often that's a time when the mind starts racing.
Mm.
And so you want to think about, well, what kinds of things can I do to take my mind off whatever it's
Mhm.
racing on? So it might be racing about, all the things that I've got to do the next day,
Yeah.
which is pretty common. Happens to me. Um, so for me, it's listening to a podcast. So I'll just like put my headphone in and listen to a podcast about something that I'm not, hugely interested in, but I like to listen to. And quite frequently, that'll just take my mind off everything that's going on and I'll fall back to sleep quite quickly.
Mm.
So sometimes I'll put my headphone in and I'll put a podcast on and I wake up the next morning and I think I cannot even remember hearing it.
All right.
Sometimes I'll lie there and listen to half an hour and put it on again for another
Yeah.
half hour. So it's a bit variable, but anything that can take your mind off um, what's racing on the mind can be very helpful just to allow the body to fall back to sleep.
Yeah, yeah, that's great tips. Because sometimes I feel like I haven't slept all night, and because the husband might be snoring or the husband is making noises. Sometimes he talks in his sleep, and then I feel like, oh, I haven't slept the whole night. And then, but I just lie there resting. But my devices, I wear, I have a Garmin watch and I have a Whoop watch, and I wear them for sleeping. And the devices actually tell me that I did sleep and I do
Hmm.
feel all right the next day, and I just function no problem.
Hmm.
So yeah, maybe the perception is not quite right that I didn't sleep the whole night. Maybe I actually did get some sleep.
Could well be the case. Could well be the case. Yeah.
What do you think about these devices with the sleep monitoring? Do you think they're accurate?
I think that they are quite accurate. I think they tend to overestimate total amount of sleep. So sometimes people, if they do lie there for long periods awake, it may pick it up as them being asleep. So um, I think that they also tend to overestimate sleep fragmentation. So they tend to suggest sleep quality is worse than what it actually is.
Oh, right.
So often they'll say oh, the sleep quality was very poor, but that doesn't necessarily mean that the sleep quality is poor, because when we correlate that to actual sleep study polysomnography, then we find that actually it probably overestimates, fragmentation of sleep or waking during sleep. I think the most useful thing for them though is that it gives you a really good idea for someone's circadian rhythm.
Mm,
And so it shows you when they're sleeping and whether they're in a good routine. So sometimes if people have a Garmin or a sleep tracker, I'll ask to look at it, and I'll say, look, some nights you're going to bed at 7 p.m., some nights you're going to bed at 2 a.m.
mm,
It's all over the place.
yeah,
And so you get a good idea for someone's pattern, and that can be, give you a good insight as to why they may have a problem with sleep.
yeah, yeah. I'm pretty strict. I have to get to bed before 10 and I get up at 5:30 and start my day. And
Very good.
I, yeah, I really enjoy the routine and get up at the same time.
Yeah.
Except there's not much sun going on in the middle of winter with the 5:30 and even 6 o'clock.
Yes.
And then I have patients, sometimes I tell the patients that you've got to get outside and get some sunlight. And they say, oh, there's not even any sun.
Mm. So what you can do is you can get light glasses, and
Okay.
I can show you quickly.
Yeah.
So these are my light glasses. I know that
Okay.
people listening to this can't hear that, but essentially these are glasses that can sit over your normal glasses if you wear glasses, and they're
Okay.
battery operated. And so when I turn them on, there's a little light underneath that shines light into my eye. And so these are really useful for people with circadian rhythm problems, because when they need to use light to adjust their body clock, it's very hard when it's dark.
Mm,
And light just from the room isn't light enough to have that
mm,
effect on our body clock.
mm,
So light exposure in the morning is really important. And even for people who don't have circadian rhythm problems, just through winter,
mm,
um, getting that light exposure in the morning can be quite helpful. So I quite frequently use these. I use
mm. Where do
them
you get them
to
from?
show them to patients, but I also use them myself. When I get up early in the morning, if I'm doing a bit of work or getting ready, I'll put them on just to get that light exposure when it's so dark these mornings. So this one's called Retimer, and you can buy them online. It's
Okay, great.
re-timer.com, Retimer, um, and they're great.
All right, I'll check it out. I haven't got any of one of those yet. I wear blue light blockers in the evening when I'm watching telly or going on my screen before bedtime. What do you think about the blue light blockers in the evening?
I think they can be useful. I think some people certainly get benefit from that, and blocking out some light is probably useful for the same reason, especially if you have a body clock issue or difficulty getting to sleep at night time. You don't want light shining in your eye because that's turning off the melatonin, and you want the melatonin, which naturally starts being secreted in response to darkness, to be able to fall asleep and have good quality sleep. So certainly avoidance of light is good. I think one of the problem with the blue light blockers and also on phones and devices these days, they have settings that they can reduce that light,
Yep.
but it's still not good because the better thing to do is not to shine your phone and your device into your eyes
Yep. Yep.
in the evening, because the device also has other issues that is best avoided. So, certainly scrolling through social media, and activating the mind through what's on your phone is not a good idea. And shining the light into your eyes is not a good idea. So, I think in general, it's best to avoid the lights.
Hmm.
But watching TV is usually probably okay, and wearing something that blocks out the blue light may well be useful. They've tried to look into that in terms of like clinical studies and things, and they've never really found any strong evidence in their support. But once
Hmm.
again, it's not dangerous. If it's
Yeah.
helpful, it's helpful. And so, it certainly can't do any harm.
Amazing. That's
Mhm.
great. That's great advice. Um, uh, that's great. What other tips would you give to my listeners that wants to improve their sleep?
Um, Often I get asked about sleeping tablets,
Mm,
which is interesting. And I think often people take sleeping tablets to help their sleep. I very rarely recommend sleeping tablets to people because I don't think that they really have any role in the long-term improvement in people's sleep.
mm,
They tend to improve people's perception of sleep, but they don't tend to improve how people feel the next day, which is interesting.
yeah.
If people do take sleeping tablets, I think one of the problems is that they tend to take them in the wrong way.
Hmm.
And what I mean by that is that they set themselves up to fail.
Mm,
So what I find is the typical situation is that somebody will go to bed thinking, I haven't slept very well recently. I hope I sleep better tonight. But if I don't, I'm going to take a sleeping tablet.
yeah.
So then they go to bed, and of course they don't sleep very well because they've already prepared themselves for
Hmm.
sleeping badly. And then they get frustrated that they're not sleeping well. And then they think, I'm going to take the sleeping tablet. They take the sleeping tablet, then they feel guilty for having taken the sleeping tablet.
Yes.
And then they go out the next day and they're annoyed because they couldn't sleep and they had to take a sleeping tablet. So they've set themselves up to fail, they've failed, and they've implemented their failure plan. I think the better way to do it is to use it as a plan for success. And so, what I recommend to people is that you don't take a sleeping tablet, you maintain your normal routine, and you can't do anything about what happens between the time that you go to bed and the time that you wake up, except relax, do things to relax the mind and allow you give yourself the best opportunity to sleep. If you get up in the next morning and think, I've slept really badly last night, you think, okay, that's fine. I haven't slept very well. I'll get through today. I'm going to sleep better tonight because I'm going to be tired. Then you do the same routine, same time to bed, same time to get up. If 2 nights in a row you haven't slept very well, think, okay, well, third night I'm definitely going to sleep well because I've had 2 bad nights now. If you have a third bad night of sleep, when you get up the next morning, that's when you should decide, I'm going to take a sleeping tablet. So you decide when you get up, that's 3 nights in a row. I need to get back on track. So what I'm going to do is for tonight, tomorrow, and the next night, 3 nights in a row, I'm going to take a sleeping tablet half an hour before my scheduled time for sleep, and I'm going to do that. And so then throughout the day, they're not worried about, oh, I'm not going to sleep very well, because they know they've got a plan. They've got a plan to succeed. They're going to sleep well
Mm,
because they've got the plan. They're going to take that sleeping tablet half an hour before bed. They're going to take it. They're not going to feel guilty about it because they plan to do it.
mm,
And then they sleep better and do it 3 days in a row and then go back again. And I think and the only difference really is the difference in psychology. And sleep is so much about psychology and how we view
yes.
it.
Yep.
And
Yep.
you have a few bad nights of sleep and you start to worry about how you're sleeping. And the more you worry about it, the worse it gets. And you have this
Yeah.
negative connotation about sleep. And when people sleep really well, they don't really think about it.
Yes. But then as a GP, I'll be worried about addictiveness and then worried about they keep coming to ask for sleeping tablets. And there are
Mm,
quite a few patients that keep coming every couple of weeks. They've got to need another script for temazepam.
mm.
So if they take it 3 nights in a row, would you worry that they can't sleep on the fourth night if they don't take the sleeping tablet?
Well, I think the idea is that it's just used to get back on track.
Hmm.
So get back on track, and then the idea is that you don't use it
Yeah, yeah.
unless there's
Mm,
3 nights in a row of poor quality sleep. Not one, not two, not like one night, then a few nights are okay, and then a bad night, and three over a week. 3 nights in a row. Because what actually happens is that most people actually don't want to take them.
mm,
They actually want to get off them.
mm.
If people are taking sleeping tablets all the time, then they obviously need a different approach slightly because they need to
Yeah,
wean off. So they don't want to just stop suddenly because that can cause other problems. So they need to wean off. But frequently, I think people do take them just, as required. But when they're
yes,
taking them as required, they tend to take them, incorrectly
yes,
in response to a bad night. And then they'll take them, at 1 a.m., which I don't think is
yes.
a good idea.
And then you have a sleepy the next day because you're having a hangover
Yeah,
from
that's
taking it
right.
too late.
Yeah. But in general, I think most people who don't take sleeping tablets, who present with a problem with their sleep, most of the time that problem is best addressed without sleeping tablets.
Yeah, yeah, I agree. Great. Thank you. Yeah, I've learned heaps from you, Barton. There's a lot
I'm
of
glad.
questions. Yeah, a lot of questions that I keep coming up because this is so much of the general practice that I see with all the sleep problems and sleeping tablets and snoring, breathing. And as you might know, that I have a breathing interest and I like to
Mm,
talk to patients about breathing through the nose and don't breathe through your mouth.
yeah, which is excellent.
Yeah, I actually see a lot of kids that come in with chronic coughs and they keep coughing after a cold. And sometimes just telling them to breathe through the nose, changing their practice and getting the parents to remind them. That can help them to reduce the
Mm,
coughing and even get rid of the post-viral coughs that they get.
mm. Yeah, it's amazing, isn't it? I think that that's absolutely the case.
Yeah, great.
Mm.
All right. Well, thank you, Barton. And if my listeners want to follow you or check you out or come and see you, how where they can find you?
So probably the best way is through our website, and our website is lungandsleep.com.au. Our main office is in Bentley in Melbourne, and we also do trips out to Gippsland. So we have quite a large Gippsland presence through our practice. Um, I'm also on LinkedIn, and I've also got a YouTube channel where I post lots of videos about sleep and about lung disease and procedures. And one of my most recent videos was actually when I did bronchoscopy for a patient and removed a dental uh, bit of dental metal from an implant from
Wow.
the lung of a 99-year-old man.
Wow, 99. Yeah.
Yeah.
I did see that topic, but I haven't gone into your video to have a look yet. I've actually, just to tell you, I have learned quite a bit of things from your videos over the last few years about sleep,
I'm
about,
glad.
so the video, some of it's target to the patient, some of
Yeah.
them's target to doctors,
Yeah.
and I've gone through both sides and learned a lot from your videos. So
I'm
thank you
glad.
very much.
Well, I'll keep doing them.
I will. Great. Well, thank you for your time, Barton.
Thanks, Harvey. It's been really nice to talk to you.
Yeah, great. Well, thank you, listeners, for staying tuned to the prescribing lifestyle. And I hope you've picked up some tips, especially on sleep and breathing and snoring from Barton. And if you like to see Barton, I can give you a referral to go and see him. So stay tuned for the next amazing guest, and I'll bring to you more fantastic information. Thank you.